viewers are here to discuss about diabetes ketoacidosis. Diabetes ketoacidosis is also known as DKA, and it is a serious and potentially life-threatening acute complication of diabetes mellitus. It occurs due to absolute or relative deficiency of insulin along with an increase in counter-regulatory hormone such as glucagon, catecholamines, cortisols, and growth hormones. Due to insulin deficiency, glucose cannot enter the cells efficiently. As a result, blood glucose level rise, causing hyperglycemia. Since the cells are unable to utilize glucose for energy, the body starts breaking down fats, leading to the formation of ketone bodies. Excess ketone body accumulates in the blood and causes metabolic acidosis. The classical triad of DKA consists of hyperglycemia, ketosis, metabolic acidosis. DKA is most commonly seen in type 1 diabetes mellitus but may also occur in type 2 diabetes mellitus under stressful conditions. Now my fellow teammate will talk about the causes and precipitations. Thank you.
I am Priyanka Kumari. Our topic is causal and precipitation factors has been given by our team member. I would like to introduce this topic facing you. Diabetic ketoacidosis usually develop when insulin requirement increases or insulin administration becomes adequate. The most common precipitating factor is infection, which accounted for nearly half of all cases, included urinary tract infection, pneumonia, and sepsis. Other important causes including osmosis of insulin therapy, newly diagnosed diabetes, myocardial infarction, stroke, surgery, and trauma, acute pancreatitis, pregnancy, severe physical or emotional stress. These conditions increase the secretion of counter-regulation hormone, which oppose the action of insulin and worsen hyperglycemia and ketogenesis. Earlier identification of this factor is important for prevention and treatment. Now I will hand over to next speaker who will explain the pathophysiology of DKA.
Hello everyone, myself Smriti Kumari and I am here to discuss about the pathophysiology of diabetic ketoacidosis. The pathophysiology of diabetic ketoacidosis begins with insulin deficiency. Due to lack of insulin, glucose uptake by muscle and adipose tissue decreases, hepatic gluconeogenesis and glycogenolysis increase, blood glucose levels rise significantly, and at the same time increased lipolysis occurs in adipose tissue. Triglycerides are broken down into free fatty acids. These free fatty acids then reach the liver and undergo beta oxidation, producing large amounts of acetyl coenzyme A. Excess acetyl coenzyme A is converted into ketone bodies. The three ketone bodies are acetoacetate, beta hydroxybutyrate, and acetone. Accumulation of ketone bodies causes metabolic acidosis. Simultaneously, hyperglycemia leads to osmotic diuresis, resulting in dehydration and electrolyte loss. Thus, DKA is characterized by hyperglycemia, ketosis, dehydration, and metabolic acidosis. Now, the next speaker will explain about the biochemical changes of DKA. Thank you.
Hello everyone, this is Sakshi Kumar and I am here to discuss the biochemical changes. Several important biochemical abnormalities occur in DKA. These include blood glucose level usually greater than 90 mg per liter because lack of insulin prevents the glucose uptake into peripheral tissues that leads to severe hyperglycemia. Presence of ketone bodies in blood and urine. Arterial pH less than 7.3 due to accumulation of acetoacetate and beta hydroxybutyrate. Serum bicarbonate less than 80 milliequivalent per liter. Increased anion gap leads to metabolic acidosis. Increased serum osmolality. Electrolyte abnormalities may also occur, although serum potassium may initially appear normal or elevated, but total body potassium is actually depleted due to excessive urinary losses. Sodium and water losses are also significant because of osmotic diuresis caused by hyperglycemia. These biochemical changes help confirm the diagnosis of DKA. Now, the next speaker will discuss the signs and symptoms. Thank you.
I am Fusi Jaiswal. I will discuss the signs and symptoms of diabetic ketoacidosis. Patients with diabetic ketoacidosis commonly present with symptoms related to dehydration, hyperglycemia, and acidosis. Commonly symptoms include excessive thirst, frequent urination, dry mouth, dehydration, extreme fatigue, nausea, and vomiting. In neurological symptoms may include irritability, confusion, drowsiness, coma in severe cases. Characteristics feature of fruity smell breath due to acetone. Patient may also develop deep and rapid breathing known as Kussmaul's respiration as the body compensate for metabolic acidosis. If we not treatment properly, symptoms can progress rapid and become life-threatening. The next batchmate will discuss the diabetes ketoacidosis.
Hello everyone, this is Gyan Prakash and I am here to discuss about the diagnosis of diabetic ketoacidosis. The diagnosis of diabetic ketoacidosis is based on clinical finding and laboratory investigation. The commonly accepted diagnostic criteria include blood glucose more than 90 mg per deciliter, arterial pH less than 7.3, serum bicarbonate less than 18 milliequivalent per liter, positive ketone in blood or urine, increased anion gap metabolic acidosis. Additional investigation include serum electrolyte, blood urea and creatinine, serum osmolarity, arterial blood gas analysis, electrocardiogram when indicated. Early diagnostic is extremely important because prompt treatment can prevent serious complication. Now the next speaker will discuss about the management. Thank you.
Hello, this is Anirban Bera. Now I am going to speak about the management of diabetic ketoacidosis. As this is a state which causes dehydration in the body, so the first important step is the fluid resuscitation. Firstly, start with a 0.9% NaCl solution. Give it for 1 to 2 liters over first hour to restore the intravenous volume and improve the renal perfusion.
Start.
Then, if sodium is on higher level, give 0.45% of NS or N by 2 solution. And if the glucose level is less than 250 mg per dl, then change the fluid to dextrose containing either DNS or DN by 2 solution. Second, check potassium levels before even giving the insulin. Never ever give insulin if serum potassium is less than 3.3 milliequivalent per liter. That's because insulin drives first potassium into the cells, which can cause fatal cardiac arrhythmias. If potassium is low, supplement it first. If it is between 3.5 to 5.2 milliequivalent per liter, then add potassium to the IV fluids while starting insulin. Fourth, continuous insulin infusion. Our goal is to glucose level maintenance, that is between 150 to 200 mg per dl. Administer a continuous IV infusion of regular insulin at 0.1. Our goal for glucose is to maintain it at 150 to 200 mg per dl. Administer a continuous IV infusion of regular insulin at 0.1 units kg per hour. Before, our goal is to suppress Because our goal is to suppress ketogenesis and steadily reduce the blood glucose by 50 to 75 mg per dl per hour. Now, treatment of underlying cause, any precipitating factor such as infection, myocardial infarction, or missed insulin dosage must be identified and treated. Continuous monitoring of blood glucose level is required, as well as the electrolytes and vital signs required too. Now the final speaker will conclude and discuss the complications. Thank you.
Hello everyone, I'm Sumit Singha and I'm here to discuss the complication of diabetic ketoacidosis and give the conclusion to this topic. If diabetic ketoacidosis is not treated as soon as possible, it may lead to serious complications which include severe dehydration, hypovolemic shock, electrolyte imbalance, cardiac arrhythmias, cerebral edema leading to coma, and in worst cases even death. Fortunately, with early recognition and appropriate treatment, most patients recovered successfully. To conclude, diabetic ketoacidosis is a serious complication of diabetes, which is a triad of hyperglycemia, ketosis, and metabolic acidosis. It results from insulin deficiency and increased counter-regulatory hormones. Early diagnosis, prompt fluid replacement, insulin therapy, correction of electrolyte imbalance are essential for successful management of diabetic ketoacidosis. Thank you, and I hope you enjoyed the explanation provided by our team.
I hope you enjoyed and understood our explanation given by our team, and thank you for watching.